Hi, my name is Caroline Rhodes, and I'm a physical therapist. And today I'd like to talk to you about what I do when I do an assessment and treat a newborn baby. So my background, apart from being a physical therapist, is I also studied craniosacral therapy all the way up to pediatric level. I studied many other osteopathic techniques. I've studied integrated manual therapy and other types of therapy that have allowed me to create a way of doing an assessment and treating a baby with my own unique style. So I have treated thousands of babies, and I would say that I get really good results. I've had some simple cases like colic and reflux, and more complicated cases where the baby really had a lot of misalignment throughout its whole body. So what I'd like to do today is to just show you a little bit of a demonstration of what I do with a baby and what to look for. And this is something that you can do for your own baby. You can even do it for your children that are a little bit older, because basically what we're looking for is symmetry. And so I'm going to show you on a demo that I've got with a little doll, this little baby here. And so the first thing I'm going to do when I look at a baby is I'm going to look at symmetry. So I'm just going to let the baby lie down and just let it be without moving it or adjusting it. If it's been swaddled, of course, I'm going to unwrap it. And so I just want to see that the baby's head is straight. I'm already looking to see if the face is straight. The arms should be straight and the legs should be straight. So sometimes what we'll see is the baby will be side bent off to one side, the whole trunk. We can also see a rotation in the baby where the baby wants to lie like this all the time, or maybe with the arm over to one side, or the head over to one side. So these are all things that I'm just getting as a general observation. Now there is another way to check for a baby's alignment, which is completely safe. Some people, I always ask if it's okay if I do this. If not, then of course I don't. But actually what I like to do is I like to hang the baby upside down. So this will give me a really quick test. So I'm going to hang up this little baby upside down. I'll usually use another person to help me. So I hold on to the ankles and I lift the baby up. So if the baby is perfectly aligned, it's going to hang straight. The head will be straight. So some of the things that I might see is a baby's head will be hyperextended. So that tells me a lot. Or sometimes you'll see the whole rotation or twisting inside the whole baby's alignment. And so I can tell very quickly what's going on. So some parents don't feel comfortable with that, so I don't do that, and I can find other ways to do that. But that's also, once I do an alignment, that's actually a nice exercise, and babies, if they don't have restrictions, actually like it very much, to be able to hang upside down. So the first thing I'll do when I check a baby is I want to check how it's sucking. So if there's some breast milk or some formula, I'll put a glove on, I'll put some on the pad of my finger, and I'll put my finger inside the baby's mouth, and I want the pad to go all the way up to the roof of the mouth, okay? A baby who has a good sucking reflex will immediately take my finger into the mouth. It will even go up to my second knuckle. This is normal, and hopefully that's what the baby's doing. If the baby has a weak suck, that's telling me a lot of different things. If I feel the roof of the mouth when they suck every time they pull, the palate should elevate. So if the palate's not elevating or it's not a very strong elevation, that's also telling me some things that I would like to correct. So I will gently do a little bit of a mobilization when I check the palate to make sure it's lifting properly. And I want to explain to you why this is important. So basically when a baby's feeding, let's say for example if they're breastfeeding, they need to be able to finish one breast in a relatively reasonable amount of time. I would say 20 minutes maximum. And they need to be able to pull the hind milk without any effort. So now I know this baby has a very good suck. Okay, if they're on formula, it shouldn't take that long. Unfortunately, when a baby has a weak suck, what will happen sometimes is they'll get, the mother might get a teat that is really too big, so that the baby doesn't have to suck very hard in order to get the milk out, and that's actually supporting a dysfunction. The baby should be able to get the milk out, and if it's not doing that, then you need to find a therapist who knows how to check the palate and make sure that that's corrected so that they can suck properly. So I'm going to show you what that looks like on a small skull. So this is just a small infant skull. Move the baby out of the way. So I'm just checking here. And what we're wanting to see biomechanically, I'm going to show you on an adult skull. So this is more of an adult-sized skull. And I've taken the mandible off, the lower part of the jaw, because what we want to really focus on is the roof of the mouth, which is here. So in a baby, what I'm doing is I'm checking the palate where this green bone is. So when that green bone elevates, what it does is it rocks this red bone called the vomer. And when that red bone rocks, it makes this whole big yellow bone here move. And that's, from this angle, is called the sphenoid. It's a big butterfly-shaped bone. This bone we call the keystone because it's attached to every other cranial bone in the head. And so when this moves, it affects the way all the other bones move. And this is really important. It's also important because this yellow bone is attached to the purple bone. This purple bone is the back of the head. It's called the occiput. And so this joint needs to have a certain rhythm. This butterfly-shaped bone, the sphenoid, needs to rock. So the reason we want to make sure the sphenoid is rocking is right in the little middle of this bone here is called a, it's actually called a saddle or solotertia. And that's where the pituitary gland sits. The pituitary gland is considered the master gland of our endocrine system, also known as our hormone system. And this needs to release growth hormone and sex hormones. So this is hugely important for children, for them to develop and grow properly. So the sucking, a weak sucking, can lead to a baby not developing to its full potential or growing to its full potential. And if it's really compromised, they may be labeled or diagnosed with failure to thrive. So this is very simple to correct. It's important to correct because we want the palate to elevate. We want to make sure they're sucking properly. And also, like I said, we don't want to give them a teat that makes the milk flow too easily, because when they're sucking, it's making the whole mouth develop properly, the muscles are contracting, and also when they contract really hard, it also helps to align the head. So all these little bones in the baby's head, there's a lot of space in between them. When we look at a baby's skull, everybody knows the soft spot on the top of the head. It's 1 of 7. So this is the one that closes the last. It could be up around maybe closer to about 2 years of age. The first soft spot that closes is the forehead, and that's actually in 2 pieces. The other soft spot, can't see it very well on here, so I'll show you on here. So this bone here, the temporal bone, there's 2 soft spots over here. So that's on either side. And then the other one is where this green bone, these are parietals, come in contact with the purple bone. And that's a soft spot. So it's kind of like tectonic plates. They're kind of moving around. When a baby's sucking properly, then these plates kind of line up better. We're releasing the pituitary gland's releasing hormones, sex hormones, and growth hormone. And so we want to be able to make sure that that's all happening. So when a baby goes through the birth canal, we're made this way, we're created this way, because these 4 bones have to overlap so the baby can get through the birth canal. Okay? That's normal. So it's not unusual for a baby to be cone-shaped a little bit after it's been delivered naturally, vaginal birth. It should settle within the next 72 hours, and it should be nice and smooth. When a baby goes through the birth canal, and one of the other things that helps to adjust this is when the baby cries. Okay, so when the baby cries really hard, it contracts really hard, what's called the dura. And the dura is a connective tissue that surrounds the brain and spinal cord. Okay, and see that hole right there, that purple bone? This is where the spinal cord comes out. So we have the brain, spinal cord, that's called the foramen magnum, also called, well, foramen magnum means big hole. So the spinal cord has to come through here, and that dura, the covering around the brain and spinal cord, comes all the way down, and it attaches to the lower part of the spine, which for us is a triangular bone called the sacrum. The sacrum is, you can tell where the sacrum is because the two little dimples in our back is our sacroiliac joint. So from here it comes down a little bit like a triangle. Okay? So we want to make sure that the connective tissue gets a nice contraction when the baby cries or when the baby sucks. It's really interesting sometimes when children are a little bit older, if you have a child that's still sucking its thumb or won't get rid of its pacifier, its palate is not elevating properly. And so sometimes there's also a hang up in one of these cranial bones, and this is really interesting because when you see a baby that sucks its thumb and pulls on its ear, it's trying to release the temporal bone. It's jammed. Sometimes they take their hair and pull, it'll be on the same side because they're trying to release the parietal bone while they suck. So when you're sucking, it increases all this rhythm, and then it also helps with pressure, and it can alleviate a lot of tension. So we know that there's something jammed when a baby is still sucking on a pacifier or its thumb, and either pulling its ear or maybe sometimes banging its head. So, sadly, these babies get labeled with some sort of a condition, but baby's actually just trying to, or the infant's just trying to self-correct.